People go to see doctors and nurses for many different reasons, but sometimes the real reason is far more serious than what they say they're there for. Sadly, the stigma of mental health and suicide can get in the way of people asking for help. Many people put on a brave face, even if their mood is very low. A healthcare worker is in a unique position to recognise the signs of someone who is struggling with their mental health or who is thinking about suicide. They can ask gentle yet direct questions. They can take the time to listen, and they can show empathy, offer ongoing support and follow-up. A few words can make a world of difference. The teenage years can be full of excitement, opportunities and newfound freedoms. Yet they can also be times fraught with worry about exams, relationships and keeping up with peers and the latest trends. For some, this burden can become so overwhelming they take their own lives. Suicide is never the answer. There's always hope. If you're a school principal, put a plan in place for helping students and teachers to stay mentally healthy. Organise training for staff on what signs to look out for and how to have sensitive and compassionate conversations. Create a safe school environment where students and staff know they can seek help and talk to someone if they need to. A few words can make a world of difference.
Being at work can be good for mental health, but the increasing pressures at work can be stressful. A difficult work environment or ongoing work-related stresses can worsen the mental health of employees. In some circumstances, they may take their own lives. But suicide is never the answer. There is always hope. Employers and managers have an important role to play in looking out for the mental health of their staff. They can help create a culture where people feel safe to talk about their mental health and to seek help. Employers can help their staff to feel supported with their mental health, which is good for staff and good for employers. A few words can make a world of difference. In an emergency call-out, a person's real situation may not always be obvious. Emergency workers are often the first on the scene to a mental health crisis or suicide attempt. They have a pivotal role to play in what happens from there on. The person they are called out to help will be in need of support, empathy, and kindness. Always treat situations like these as serious. Encourage the person in difficulty to talk. Be the bridge to follow-up care. Emergency workers should also look out for each other, because sometimes they need help too. A few words can make a world of difference.
Lignado, je vous écoute. Donc elle a des idées noires à cause de l'école principalement.
Du lundi au vendredi de 8h à 18h.
From Monday to Friday, 8 a.m. to 6 p.m., we, the psychologists in charge of prevention here, respond to phone calls. And from 6 p.m. to 8 a.m., weekends and holidays, our nurse colleagues from the hospital treatment team are on call.
Hospitaliers qui assurent les téléphones. C'est pas une ligne d'urgence, c'est un tout petit peu différent.
It's not an emergency line, it's more of a support line available to young people aged 13 to 25 who are at risk of attempting suicide, meaning that they say they want to die. Some of them may have thought of scenarios or ways to end their life. In any case, they all suffer from intense psychological distress.
Qu'est-ce qui se passe en ce moment pour que vous ayez des idées suicidaires? Qu'est-ce qui vous arrive? Et qu'est-ce qui fait que c'est devenu impossible à communiquer avec votre mère en ce moment? C'est des jeunes qui bien souvent sont à...
These young people, either adolescents or young adults, are often at a stage in their lives when a lot of change is happening, whether it be on a physical level, in their relationships, or regarding how they apprehend their future.
Et puis quand vous me dites je me coupe la peau et puis j'ai envie de mourir comme ça, est-ce que vous pouvez m'en dire un petit peu plus? Qu'est-ce que vous entendez par là? Est-ce que vous vous coupez dans le but de mettre fin à vos jours? Est-ce que c'est pour vous soulager? Qu'est-ce qui se passe dans ces moments-là? Et est-ce que dans votre entourage, il y a quelqu'un qui est au courant de ça? Est-ce que vous avez déjà pu en parler avec un professionnel ou peut-être un adulte de confiance qui est autour de vous?
Malatavi is a center which is organized with the idea of accessibility and continuity of care for teens with suicidal ideation. That's the main philosophy.
Dans ces moments-là, ce sont des jeunes qui sont
In these
très
moments,
angoissés,
they feel very anxious,
déprimés,
depressed,
qui perdent de la
demotivated,
motivation, qui
and
sont
sad
tristes
without
aussi,
necessarily
sans
knowing
vraiment
why.
savoir pourquoi.
Therefore, our goal is to support them at this particular stage and to get them to talk about their emotions so that we can work through this discomfort and pain together in order to improve their well-being.
Tout dépend des appels.
Each call is very different. It all depends on the situation. Certain teenagers are more comfortable over the phone, in which case we do what we call follow-up calls, where we call them back 2 or 3 times. I remember a boy with whom I talked 8 times over a period of a few weeks before he agreed to come in person. He needed to be reassured. This initial contact is for counsel and prevention. However, if we see that there is more severe depression, we will use it as therapeutic leverage.
Thérapeutique potentiel, de dire, mais voyez là, on entend.
For instance, we will say, I can hear that you are saddened and upset by your situation. You are alone, you don't see your friends anymore, and have trouble communicating with your parents. So it would be very beneficial for us to meet in person and further talk about this.
Ensuite, l'adolescent est vu seul, à un moment où il
Then the adolescent is seen alone so that they can talk about their problems. We assess their psychological state and if any suicide attempts have been made. And we scan for other vulnerabilities such as toxic substance use or whatever addictions.
Une prise de toxique, une addiction quelconque. On évalue aussi beaucoup le...
We also assess their network, meaning their relationships with peers, if there was cause for crisis in the community, like a breakup or harassment at school or harassment on social media.
Un harcèlement à l'école, un harcèlement sur les...
All these issues are discussed with the adolescent so we can have a better understanding of the risks and act accordingly.
En danger de l'adolescent et répondre en conséquence.
Probably about half of the kids that present here have a depression. The way they react in breakups with a peer or a fight with parents it can be when emerge the suicidal ideation and or the suicidal behavior. And behind that, very often we find depression.
Un jeune qui s'enfonce dans la déprime, qui se met dans un retrait social.
If a teenager dwells on sad feelings, shuts off socially, stops communicating, and loses interest in activities that they usually enjoy, although we tend to talk of depressive behaviors, these are fairly evident signs of depression.
Il y a aussi tout ce qui touche au côté un peu plus
We also evaluate somatic aspects. For instance, we look at sleep quality, such as insomnia, troubles falling asleep, or interruption of sleep, as these can often cause weariness that affects their mood. We also look for disordered eating patterns, if there is rapid weight loss or weight gain. So we need to check for these conditions on the first appointment.
Il y a plusieurs façons de se faire du mal. Est-ce que vous, c'était plutôt par la scarification? Il y avait d'autres choses? C'était comment?
Moi, c'était plus dans la scarification. Ouais. Et juste ça.
Ouais. Et puis, le fait de se faire du mal, à ce moment-là, ça signifiait quoi pour vous? C'était finalement...
C'était quand j'étais pas bien, le soir, quand j'étais toute seule dans mon lit, quand je pensais à tout. J'avais besoin de relâcher, du coup, je le faisais. C'était la seule manière de tout oublier, de me dire... et de relâcher un petit peu la pression.
Et finalement, c'est quoi pour vous qui a été le plus aidant, le plus porteur en fait pour aller mieux?
C'était de vous en parler, d'en parler à quelqu'un. Parce que j'avais besoin de tout dire à quelqu'un, parce que je pouvais pas tout expliquer à ma mère. Mais à vous, je pouvais tout vous dire sans que vous alliez le répéter à ma mère. Du coup, ce qui m'a pu aider, c'est de vous en parler et de pouvoir tout vous dire sans tabou.
For the kids we see, so most of them, we never start with pharmacological treatment. We start first with meeting them and talk therapy, and for some of them, if we have the impression that there is little effect of a relationship or even sometimes of being hospitalized, and then we start pharmacotherapy, but it's not something which is systematic.
C'est vrai que ma fille, elle est hermétique, un petit peu hermétique, mais parfois elle passait pas mal de temps dans sa chambre, mais on se dit c'est bon, elle est adolescente, hein. Autour d'elle tout allait bien, alors avec ses amis, l'école, des très bonnes notes, toujours, très bonnes notes, franchement, très bon élève. Et là, elle m'a avoué qu'elle ne se sentait pas bien du tout. D'abord, elle ne voulait pas me dire qu'est-ce qui s'est passé, alors j'ai dû un petit peu forcer la situation. Et là, elle m'a dit, maman, je sens que je ne veux pas vivre. Pardon.
Et comment vous avez géré cette situation? Comment vous avez fait?
Désolée, je me souviens de ça et je suis encore émue.
Vous pouvez vous arrêter une minute?
Très émue, on s'est embrassés, on était très proches. Et j'ai dit d'accord, alors tout de suite je vais trouver l'élève. Je vais chercher l'élève, je vais la trouver. Et je me suis souvenue, je ne sais pas comment, de la pure, de Malatavi.
The inpatient unit, to respond to the accessibility aspect, is in an apartment. It's not really like an inpatient unit you would imagine in a psychiatric hospital. So that's, the idea for that is to make it more accessible for the teens. And they have all their individual room. It's looked more like an apartment with different children. Every one of them have got their own treatment plan, but there is a lot of things that are happening in group, formal groups and informal groups. The mediation could be talking, but it could be art therapy or psychomotricity.
Les jeunes qui arrivent chez nous ont l'âge de 14 ans.
Here at the inpatient care unit, we welcome adolescents from 14 to 18 years old. They usually stay for 2 to 3 weeks. Some of them have attempted suicide before. Others are expressing suicidal thoughts. Among these teenagers, we can sometimes find signs of what could be depression. In others, we sometimes see signs of what could be psychosis or schizophrenia, as well as sometimes eating disorders. But we don't fixate on these conditions. Rather, we care for them as people to help them get through the temporary difficulties. And we see how we can work with them and their resources. Then, after a while, depending on each situation, these symptoms can decrease.
With the help of the medical staff, the adolescents define their goals for this program. The aim is to work with teenagers and find the root causes of their suicidal thoughts or suicide attempts, and really understand what goes on in their mind. By understanding the situation, we can not only prevent further attempts, but also turn it into something creative. We believe that if an adolescent has attempted suicide or is looking to attempt suicide, it is because they're unable to find themselves elsewhere, and it is hacking at their will to live.
Est-ce qu'il y a eu d'autres adultes qui ont été des ressources pour vous, des gens de confiance avec qui vous avez pu parler un peu de toutes ces choses-là que vous viviez qui étaient difficiles?
Oui, il y a eu mon conseiller social à mon école que j'allais voir régulièrement, à peu près toutes les semaines. Il me suivait pour savoir comment ça allait, et voilà.
Et lui, il avait vu votre mal-être, il avait réalisé que vous n'étiez pas très bien à cette période-là?
Un jour, il était venu me chercher en classe et il m'avait demandé de lui montrer mes bras. Et c'était tout infecté, du coup, il m'a emmenée à l'infirmerie, il m'a désinfecté, il m'a mis des bandages et il a vu que j'étais malheureuse. Et à un moment, il a décidé d'appeler ma mère parce qu'il ne pouvait pas me laisser comme ça.
We have also a network which is called Erdado, where we can speak about specific situation, and the way it's organized is really not medical driven. It's really built on the network of the different people around kids, school, educators, different social workers, and so that's one part of it. And also when the kids are in care, we have a lot of what we call réseau networks. We do a lot of meetings also to trying to build this net around the kids, a security net, which is built not only by us but also by all these professionals.
Une fois qu'on est sollicité par l'adolescent,
once the adolescent or his medical or school network has solicited our help, we ask that the parents be informed of the concerns raised and of the reasons that motivated our intervention. In addition, we contact the parents directly and suggest to set up an appointment with them in the presence of the adolescent.
Si je vois un adolescent dans la même situation que ma fille, je lui dirais de faire confiance à la personne qui est plus proche de lui. Peut-être les parents, peut-être c'est un oncle, un ami, un professeur, n'importe qui. Parfois, avec les parents, les choses ne se passent pas très bien. Ce n'était pas le cas de ma fille, mais parfois c'est comme ça. Alors de parler, de s'exprimer, de ne pas avoir peur de dire qu'est-ce qui se passe là-dedans. Ouais.